The forgotten chapter of keto, why ketogenic diet research faded, and then returned. The ketogenic diet began its scientific life in the early 1920s as a breakthrough treatment for epilepsy. At the Mayo Clinic, Dr. Russell Wilder built on earlier metabolic research showing that the body produces ketone bodies, β-hydroxybutyrate, acetoacetate, and acetone, during fasting or severe carbohydrate restriction. From this observation, he coined the term ketogenic diet, designed to mimic the metabolic state of fasting while allowing patients to continue eating. Early clinical work, later refined by pediatrician Dr. Meine Gustav Petermann, showed striking results in children with epilepsy. Strictly controlled high-fat, very low-carbohydrate diets led to improved alertness, behavior, sleep, and in many cases, major reductions in seizure frequency. By the mid-1920s, reports from clinical practice suggested that a significant proportion of children experienced strong therapeutic benefits, including seizure freedom in some cases. For a time, the ketogenic diet was regarded as one of the most effective non-pharmaceutical treatments for epilepsy. But within a decade or two, its role in mainstream medicine began to change dramatically. The pharmaceutical shift. The turning point came with the rise of anti-epileptic drugs in the late 1930s and beyond. Medications such as phenytoin offered a far simpler solution, a pill instead of a highly restrictive, carefully measured diet requiring constant supervision. Over time, additional drugs expanded treatment options further. As a result, clinical attention and research funding increasingly shifted toward pharmacology. The ketogenic diet did not disappear, but it was no longer at the center of epilepsy research or routine clinical practice in many hospitals. A therapy that became difficult to maintain. Unlike medication-based treatments, the ketogenic diet required strict discipline, detailed meal planning, and ongoing monitoring by trained professionals. This made it difficult to sustain in general medical practice, especially as newer therapies became available. Another subtle but important factor was institutional knowledge loss. As early pioneers retired and fewer clinicians were trained in ketogenic protocols, the expertise needed to implement the diet became concentrated in only a handful of specialized centers. Not gone, but quiet. It would be inaccurate to say the ketogenic diet vanished from medical use. Throughout the mid-20th century, some hospitals, particularly specialist centers, continued to use and refine the therapy, especially for pediatric patients with drug-resistant epilepsy. However, compared to its early prominence, research activity and widespread clinical use declined significantly. In many parts of the world, the diet became a niche intervention reserved for difficult cases rather than a mainstream therapeutic option. The revival of interest. By the late 20th century, a new problem began to reshape the conversation. A subset of epilepsy patients did not respond adequately to modern anti-seizure medications. For these individuals, conventional pharmacology was not enough. This led researchers and clinicians to re-examine older, largely overlooked therapies. The ketogenic diet re-emerged as a serious scientific topic, supported by renewed clinical studies, structured protocols, and specialized treatment centers. A key moment in this resurgence came through patient advocacy and renewed clinical success stories, which helped re-establish scientific and public interest in dietary therapy for epilepsy. By the late 1990s, the ketogenic diet was once again being studied systematically, marking the beginning of its modern research era. A more accurate historical view. The history of the ketogenic diet is not a story of disappearance, but of decline and rediscovery. Research never fully stopped, but it did fragment, slow, and lose mainstream prominence for several decades as medical priorities shifted toward drug development. Today, the ketogenic diet is recognized once again as a valid, evidence-based therapeutic option in specific medical contexts, particularly drug-resistant epilepsy, and it continues to expand into broader areas of metabolic and neurological